Hi, my name is Huey. I'm going to be performing administration of intramuscular injection. First thing first is I'm going to gather my materials. I have my gloves, my gauze, alcohol pads, my morphine vial, 3 ml syringe, my 22 gauge 1-inch needle, and hand sanitizer. We're gonna verify my doctor's order on the MAR to make sure that all my orders are correct, to make sure we have the 6 right patient, right dose, right medication, right route, right time, and right documentation. The doctor has put in an order for morphine, 6 milligrams IM, and on hand I have a vial of 4 milligrams per 1 ml for the morphine. We will be drawing out 1.5 ml for this patient. I'm gonna go ahead and grab my stuff and head to towards the patient's room. Close the door behind me to provide privacy for my patient. I'm also gonna perform hand hygiene, introduce myself to the patient, and then explain the procedure to the patient. Hi sir, my name is Huey. I'm gonna be your nurse today. Can I have you verify your full name with your date of birth? Okay. Verify patients to identify with their wristband. Everything looks good. Sir, do you have any known drug, environmental, or food allergies? Okay, none. Okay, so the doctor has put in an order for you today for a morphine injection. What a morphine is we use it for pain relieving. Some of the side effects that comes with morphine is drowsiness and constipation. More serious adverse effects or shortness of breath or hives. If you have any of those, definitely let me know. During the injection or after, you may feel some burning or tingling sensation. Do you have any questions for me before I prep my materials, sir? Okay, none? Okay. So I'm going to perform hand hygiene. We're going to go ahead and don our gloves. And I am gonna take an alcohol pad. We're gonna go ahead and clean the lip of our vial here. And then we are gonna connect our syringe to our needle. Since I'm drawing out 1.5 ml of the morphine, we have to also inject 1.5 ml of air into the vial. Okay, and then invert the vial. We are drawing out 1.5. Okay, and we will flick our syringe to make sure that we get rid of all the air bubbles. Okay, once all the air bubbles are out, we will use our scooping technique to recap our needle. I will show the camera my 1.5. Okay. And then after drawing up my medication, this is a good time to verify my doctor's order again. In the MAR to verify we have the 6 patient rights. Okay, everything looks good. Now I'm just gonna have my patient go ahead and lay on their side since we are using the ventrogluteal area. I will ask for consent from my patient before exposing the patient. I will then check for any bruising, skin irritation, or edema on the site. And then we are also palpating for any tenderness or hardness. We're also checking for any, if the site has been used often. If it is, we will rotate to a new site. And then after everything has been completed, we will mark our site by using our non-dominant hand here. We will use our thumb to make sure that it's facing towards the patient's groin. Our index finger is going to be on top of the anterior superior iliac spine, and then our middle finger will be on top of the iliac crest. Our site will be in the middle between our middle and index finger. And then once we find our site, we're gonna go ahead and use an alcohol pad to clean the site in a circular motion from the inside to the outside up to 2 inches. And then once our site is dry, we're gonna take our syringe, uncap it. We're gonna use our non-dominant hand here to pinch the site. We're gonna go ahead and hold it like a dart and then go in at a 90-degree angle. Once the needle has pierced the skin, we're gonna let go of the pinch and stabilize the syringe with our non-dominant hand. We're gonna push the medication slowly in, 1 ml every 10 seconds. Once the medication has been pushed in, we're gonna continue to hold for another 10 seconds. Okay, once the additional 10 seconds is up, we're gonna go ahead and grab our gauze here, remove our needle quickly, and then gently apply our gauze on top of the site. Toss away our sharps into the red sharps container, and then we're gonna check our site to make sure there's no bleeding. If I see any bleeding, I will put a bandage on it. I will clean up my station here, and then go ahead and remove my glove. I will perform hand hygiene. I will give my a call light to my patient, load the bed, put the patient back into a comfortable position, and then let them know I'll be back in 15 minutes to reassess them, and then we will be documenting our procedure. Thank you.